ADD, ADHD, a lot of people have that. Children having to deal with it can sometimes be a little bit confusing on how to deal with it. Well, today we're talking to Dr. Sonia Spencer about Braincore therapy and exactly what the program is and workshops that you have on that and how you work with Braincore therapy and with helping people deal with ADD and ADHD.
Thank you, Jim, and I'm so glad to have you here today so I can talk about Braincore neurofeedback. Braincore is neurofeedback, and what neurofeedback does is it helps a child to fix issues inside their brain. And it does that without putting anything in the brain or taking anything away from the brain. It just helps regulate abnormal brain waves. Just like if you were to go to a gym and take away body fat, neurofeedback helps take away excessive amounts of brain waves that are helping you to not be able to focus and concentrate. So you'll be able to focus and concentrate on issues that you're trying to do in front of you. So in ADD or ADHD, many times the teacher or parents will notice that the child just cannot sit still, they're very hyperactive and so on and so forth. A lot of times they'll be getting calls from the school that something's got to happen, the child's just disruptive, they can't sit still and so forth, and they really don't know anything else to do other than put the child on medication.
And exactly, I was going to say, and unfortunately it comes to the point where, well, let's just put the kids on medicine.
And the medication is very effective. The medication is very effective in treating the symptom, but as soon as the medication is done for the day, the problem's still there tomorrow. The results of neurofeedback are permanent.
Wow.
And it's 85% effective on the children that we treat with this problem. So that is fantastic because it gives the parents another alternative to giving their children medication. In fact, the American Academy of Pediatrics rates neurofeedback as a Class 1 treatment for the treatment of ADHD.
Really?
Yes. So there has been no greater treatment that has been proven to be effective for treating that. And people just don't know about it. I mean, they're not familiar with it, they don't know about it, they just have never heard of it before.
Is this something that's new, that's come out within the last year or so?
It's not something that's new, but standardizing it so it can be used in clinical practice and so forth, that's the part of it that's somewhat new. And it's been researched in universities for decades. There's been books written about it, and it's helped so many people. But now it's available right here in Gulfport to the mainstream population for not just the treatment of ADHD, but for all types of symptoms. You know what one of the things that responds best to neurofeedback is?
What's that?
Insomnia.
Really?
Yes. We see so many people that come in here for something else. We're treating them with neurofeedback. And one of the first things that's telling them, I don't know what's going on, but I'm sleeping better than I ever had. And I forgot to tell you I had insomnia, but my insomnia has gone away since I've been getting neurofeedback.
Well, I mean, people that suffer from insomnia, it's almost like when they go to bed at night, they can't turn the brain off.
They can't turn it off, right. And so insomnia, ADHD, migraine headaches, chronic pain, those types of things, OCD, those types of compulsive, things, really respond well to neurofeedback. It helps you, have focus and concentration. The other day I was talking to the grandmother of a child that we've been treating, and I sat down and I talked to her and I said, how's the child doing? And she said, I want to thank you. Tears just started coming down her face. She said, I really prayed about coming in before I did. And she said, this has been a blessing and a miracle for us. And I can't thank you enough for, bringing this treatment here to Mississippi and helping my grandson.
Wow.
And she was just so thankful. And I could just go on and on with those types of stories about how neurofeedback has changed the lives of people that we've treated here. I have another patient who could not go shopping in Walmart at all because she had severe panic and anxiety attacks.
Yeah.
She would get in there and start putting the stuff in her cart and then just get overwhelmed.
Like the walls are closing in on her.
Overwhelmed with the people and have to leave the stuff in the cart and just run out of the store.
Yeah.
Now she's shopping in the store, getting everything on her list,
Wow.
checking out, you know, and going and doing what she wants. Now, this particular patient was an insomniac too, in addition to having the anxiety disorder.
Right.
And extremely disorganized, you know, having problems completing tasks and things like that. So when you have brainwave dysregulation, which is what neurofeedback treats, it can cause a variety of symptoms in your daily life. ADHD, the insomnia, disorganization, inability to complete your task, insomnia, all of those types of symptoms. So when the brain is regulated, it works better. And as I said, it's not brainwashing, it's just brain regulation.
Okay, so I was going to say it reprograms your brain, but no, it doesn't really reprogram. It just tweaks it.
It normalizes it.
Normalizes it. That's a
normalizes
good terminology.
It makes your brain waves that of a normal person.
Now, you do have workshops.
We do have workshops, yes, frequent workshops. In fact, we have one coming up soon. And the focus of most of our workshops is ADD or ADHD. And we just invite people to come and learn more about neurofeedback, see if this is a match for something they want to do or for themselves or their child. They're about an hour long, and we provide them right here in our office.
Okay, and you just basically show them what the program is like, what you do with it, because basically it takes a little time, but you do a series of videos. I believe it is. I mean, remember we talked about it one time before, and it's just something about depending on how it's mapped out. Right.
The first thing we do with any potential patient is, of course, find out what their issues are, and then we would do a brain map to see if we could help them with those issues according to what their brain map shows.
Right.
And if they decide to move forward with the care, then we discuss what their treatment plan would be. It's non-invasive, and it doesn't hurt. And
I had it done. It's completely painless.
Yes, it's completely painless.
Very relaxing.
And most people really enjoy and love their treatment. And I tell you what, I am a patient of neurofeedback myself, and it is the best thing I've ever done.
I noticed there was something nicer about you. I don't know, I'm just kidding.
I tell you what, Jim, a lot of people have noticed there's something nicer about
me. I'm just messing with you. If you'd like some more information about the workshop, number is on your screen. Give them a call because you have them throughout different times. But if you would like to, as she said, find out more information, give them a call about Braincore therapy. Yeah, it's about 3 seconds.